Good afternoon, everyone, and thank you for coming. Before we start, I just would like to acknowledge the Wet'suwet'en people that are the traditional custodians of this land. I would also like to pay my respects to the elders, both past and present, and extend that respect to other Aboriginal and Torres Strait Islanders who are present here today. Today we have a very interesting presentation by three esteemed experts on this area. We have Dr. Fiona Hilferty and Professor Ilan Katz from SPRC. And we also have Geoff Evans, who I'm going to give a little short introduction to because most people might not know who you are. Geoff has served for 20 years in the Australian Army Special Operations Command. In 2013, he founded Homes for Heroes, a national charity supporting homeless veterans and their families. And since 2004, he has been in the Prime Ministerial Advisory Council on Veterans' Mental Health. And in January 2016, he was appointed CEO of Team Rubicon in Australia. Welcome. The format for the presentation is 40 minutes for presenters to speak, 20 minutes for us as an audience to have question and answers. The whole session is being recorded on Zoom, and I think we have about 11 Zoom participants. Hopefully they can hear us. I think that's it. Thank you.
Thanks, Yvesti. So hi everyone, and welcome to this session today that's going to be examining the politics, prevalence and precursors of homelessness amongst Australian veterans. As Yvesti said, I'm Fiona Hilferty and my co-presenter is Ilan, and then we also have Geoff from Team Rubicon. So today Geoff will lead off the presentation. He'll be talking about the background to the study, so some of the politics involved in getting the project up and running. Ilan will be talking about the prevalence estimate of veteran homelessness that our study came up with, and then I'll be talking about the some of the reasons why our estimate is so large. Okay, so a little bit about the national study that we're talking about. The Homelessness Amongst Australian Veterans project, it began in 2016, was a 3-year project. The reports became publicly available in August 2009. This is a copy of one of 2019. This is a copy of one of the reports. There's 5 of them in total, and they're all available on the DVA's website and also on the Australian Housing and Urban Research Institute. The project was funded by the Department of Veterans Affairs, but it was governed by HURI, which is why it's on the HURI's website as well. The research involved a multidisciplinary team with researchers, including myself, Ilan Katz, and Fred Smutsky, who's sitting here with us today from the Social Policy Research Centre. We also had researchers from the Centre for Traumatic Stress Studies at the University of Adelaide. And we, as part of our study, we worked with 3 community researchers who were themselves veterans, who were working in veteran retraining or support roles throughout the course of the project. Geoff is one of them, and Geoff will be talking about the project today. So I was going to introduce Geoff, but Yvesti already has, so I'll hand over to you now to talk about the background to the study.
Prior to 2013, Australia didn't have any homeless veterans. At least we certainly didn't know about it, and that was despite a report that was commissioned by the Department of Veterans Affairs and conducted by a company called Thomson Goodall Associates. And they had done a study in 1999 and a follow-up study in 2009, and that's they said there was about 3,000 homeless veterans on the street on any given night. So in 2013, when I started Homes for Heroes, and I was pointing at, what is the number of homeless veterans, I was quoting that report and saying they're around probably 3,000, and it was dismissed out of hand. The founding of Homes for Heroes was an interesting thing. I had trekked to the Kokoda Trail with a group called RSL Life Care, which provides aged care, and they looked after veterans since the Boer War. And they wanted to do something to help veterans. And when I came back from that Kokoda trek, I was at a function. It was a Premier's function to commemorate Anzac Day, and I was talking to this gentleman who's in a suit and tie and he's the same age as me. And I said, "Where are you from?" And he said he's homeless. I'm like, "What do you mean you're homeless?" And he was literally living in a park down on the corner. This is despite being clean shaven in a suit. And that angered me so much that I started to do a few things about it. For a start, I put him in the car, and I was driving up to RSL Life Care in Narrabeen, and I rang the CEO and I said, "You've got accommodation out there that's not full at the moment, don't you?" He said, "Yeah." I said, "Good. I've got a homeless bloke in the car with me, and we're on our way. So make room." And that was sort of the founding of Homes for Heroes, although we didn't have a name for the organisation for the first 6 months because I didn't care what we called ourselves, as long as we delivered the service. And it turned out that that guy I put into Homes for Heroes at very first time, he had a double science degree, but he was also quite well connected in the veteran community, and he knew other veterans. And so very slowly, and only by word of mouth, did Homes for Heroes start to get a reputation for helping people. And I was given a lot of latitude in how we did that, because what I found is people who are homeless, they needed help right now. Housing first is the sort of the best model. Once we put them in accommodation, then it was very much about what wraparound services we could provide to keep them there. And then more by luck than anything else. So it was luck that I had Trichocoda. It was luck that I had met this guy. And then a couple of journalists found out about homeless veterans, and they came up to Narrabeen, and they were just absolutely shocked with what they saw. And I was doing a radio interview, and Peter Whish-Wilson, one of the Green senators, heard me on the radio and asked me to come down to Canberra to meet him. And then I ended up meeting the shadow minister for Veterans Affairs as well. And then they started to sort of push the government a little bit. And around the same time, in about 2015, I campaigned again, to the New South Wales government to have veterans recognised as an at-risk community in their annual Veterans Health Assessment. And that was successful. And because of that work, I got put onto the Prime Minister's Advisory Council for Veterans' Mental Health. And that's where I was really able to start pushing this idea that, we actually have homeless veterans, they're real. The Department of Veterans Affairs got sick of me nagging, and from my perspective, lives were on the line, because if you're homeless, your whole life has fallen apart, and just a little bit further down the road from homelessness is suicide. So I genuinely believe that lives are on the line, so I didn't have much to lose. The Department of Veterans Affairs got sick of me outing them on this issue, and they sent 3 people up to Narrabeen. And at the time, I had about 50 or 60, I can't remember exactly, veterans in accommodation up there. And they went around, and I introduced them to as many as I could. And the person, his name was Geoff, the same as mine, who was in charge of policy response, came to me at the end of the day, and he said, yeah, a lot of these guys are homeless. And the example is he used, as I had an Afghan veteran there who had domestic violence issues with his wife, was kicked out, had an ABO put on him, and so he couldn't go home. He'd been living in his car for 5 months. But because he owned the house, they didn't believe he was homeless. So I was dealing with that kind of semantics. If you live in a car for 5 months, I reckon you're homeless. Later on that afternoon, I had a mother call me on the telephone. I had these 3 people from DVA, and I put them on speakerphone. And the mother is describing how her 24-year-old son went to Afghanistan and came back a completely different person, and he'd been bashing her. And she was asking me to take him into the program. And that got their attention, but still there was no real policy move. As Homes for Heroes got bigger, we got more media attention with the help of Peter Whish-Wilson and a few others. We got a Senate inquiry up, and the Senate inquiry looked at veteran homelessness. Now, at that inquiry, I put in a detailed submission. The Department of Veterans Affairs put in a submission estimating about 300 homeless veterans. Now, this is at a time when I had at least 60 or 70 up in Narrabeen, so I don't know where they came up with that figure. Then there was another inquiry. There was the suicide study, which looked at it, and it sort of, let me just show you, this is sort of what I learned sort of anecdotally. People come out of defence, and they track all right for a little while, and then there's a definite turning point. And it starts with, loss of self, loss of identity, loss of purpose. And then it goes on to starting to drink a little bit more. Then maybe your mental health issues start manifesting, can't get a job. Now struggling with the family relationships, starting to drink harder or use prescription drugs or illicit drugs. And by the time you're starting to get down here, you're looking at homelessness. Usually family breakdown is the last straw, or criminality, looking at going to jail. And then, as I said, just a little bit further along from homelessness is suicide. Some people, when they come out, they get a job and they track well and they can extend this period before they start to do this. Some people, they'll never experience this, but the guys facing challenges, and it's only a small percentage. Only about 20% of veterans ever lodge a claim with the Department of Veterans Affairs. So 4 out of 5 have got no issue. That's an important thing to say, because when we think about veterans in this country, we think about victims, and they're not all victims. And 4 out of 5 are good to go. But of that 20%, my experience was you divide them into thirds. A third had really chronic, ongoing issues they're probably going to have forever. A third would bounce back quite quickly, given the right support, and there's a third in the middle that could go either way. So just to come back to how we got the study up, so we were pushing through through the Prime Ministerial Advisory Council, we're getting a lot of political pressure from the opposition parties, from Peter Whish-Wilson, and then the government eventually acceded that, hey, we do need to have a look at this, because the headline of the 3,000 was being quoted, and they didn't like it, and they wanted to have a good close look and come up with an actual definitive number. It was a lot of work. We had managed, by the time we got this inquiry up, to get the New South Wales government to provide housing to veterans as a pilot, and that pilot worked really well. And then we would all work together to provide wraparound services. And the plan was to get COAG, so the Coalition of Australian Governments, to replicate this New South Wales government policy around the country. And we just haven't quite been able to get there. But it's still a work in progress. So I'm going to hand over to my colleagues now. That's the background to how we got the report to happen. And Fiona, if you want to talk about the outcome.
Thanks, Geoff.
Okay. So a bit of a change of pace. Just to start off, as Geoff said, we didn't know before how many Australian veterans were homeless. There were these two studies with very discrepant findings using different definitions. The Veterans at Risk report estimated 3,000. That was just based on census data and comparing veterans demographically to people in the census and then extrapolating from that. The 200 to 300 homeless veterans, they've said to us that this was based on people literally on the street, but nobody ever knows how they got to that figure. And as Geoff was saying, effective policy and service planning, you actually need to know, at least in broad terms, what the quantum of this problem actually is. And from a policy perspective, really until quite recently, again, as Geoff said, homeless veterans has not been a policy priority. So just from a research perspective, and I'm not going to go into this in too much detail, so you can ask more questions on the sort of technical aspects, but it's actually quite challenging to estimate the prevalence of homeless veterans, and that's possibly one of the reasons why there hadn't been a previous estimate. Firstly, there's some definitional issues. What is actually meant by homelessness, and different definitions of homelessness can produce quite widely differing estimates. Secondly, there are also debates about what do you actually mean by veteran, and veteran can mean anything from somebody who's actually experienced deployment in a battle situation. At the other end of the scale is anybody who's been a reservist for half a day might be counted as a veteran. So somewhere in between that, you've got to come up with a definition of what is meant by a veteran. The second group of issues is measurement issues. So in the census, there's no veteran flag, so nobody knows who's a veteran. And similarly with other major studies of homelessness. So in order to do that, you have to link more than one data set with another, and this is what we're trying to do. Also, and importantly, there's no definitive list of serving personnel prior to 2001. So there's a list of people who've served post 2001, but if you've served before 2001, there isn't a database of those people. And obviously, quite a high proportion of veterans served pre-2001. So there are some proxy measures. For example, for 1 year, we've only got data. There's a veteran flag in the Special Homelessness Services data collection, which I won't go into, but homelessness services collect data on people and they report to the AIHW. And in 2017 and 18, they reported the number of people who identified as veterans in that data set. We haven't seen the follow-up for 2018-19, but hopefully that'll come out soon. But service use is not a good proxy for prevalence, especially for veterans who are reluctant to access mainstream services. And I think Fiona will talk a little bit about that. So looking at the numbers that actually access services gives you a very, very distorted picture of the actual prevalence in the population. So what did we do? Just quickly, our aims were firstly to try and estimate the prevalence, and secondly to look at some of the risk factors and transitional processes and trajectories into homelessness. And we had a number of methods. Firstly, rapid evidence assessment, so literature review, to look at the methodologies for estimating prevalence. We collected qualitative interviews with homeless veterans, representative from organizations and other stakeholders, and that's what Fiona will be talking about. We linked the Specialist Homelessness Service data collection with the ADF personnel database to identify veterans in that data set. So as I said, it's a proxy, but we wanted to do that as well. But remember, that data set only goes back to 2001. And we analyzed this two surveys. Firstly, the Transition and Wellbeing Research Program, called the TWIP program for short, and the Military Health Outcomes Program, called the MILHOP program. And so we took these surveys of veterans and then linked them to the administrative data to estimate the prevalence. So in the main method was using this TWIP data, the transition and welfare data, and that was the survey of people who had transitioned from ADF services between 2010 to 2014. So the total was 24,000, of whom 4,326 completed the survey. So I guess around a fifth completed the survey in 2015. And the survey did include a number of questions examining homelessness. Just to say that some of the other findings, for example, about mental health of veterans come from the same survey as well. So it covered a range of different issues. And what we found was that 5.3% of the weighted survey respondents, so 1,317 estimates, so that's 1,317 out of the 24,000, met the ABS criteria for homelessness in the 12 months prior to completing that survey. And we then extrapolated the proportion of homelessness, so that 5.3, to the full cohort of people who have transitioned since 2001. So the total number is just 109,000. So we took the estimate from the 24,000 to the full 109,000. And we got this just tells you about the different data sets that we used. The important thing is that, again, that we excluded veterans who served prior to 2001. So it excludes the first Gulf War, Vietnam vets, and obviously Second World War vets, etc. And so the estimate that we got to was 5,767. So there's just below 6,000 veterans who experienced homelessness within a 12-month period between 2010 and 2015. So that, if you want to put, that's the accurate definition of what we found. So in a way that, remember the two previous estimates were 3,000 and 300. So this is almost double what the higher estimate was previously. Having said that, it depends on your definition, and this is 12-month homelessness rather than homelessness on a particular day. Delving down a little bit and distinguishing levels of homelessness, just under half were homelessness for less than 4 weeks in that 12-month period. And then 26% were homeless for between 1 and 4 months. So around a quarter can be homelessness for a significant period, and then 5%, 5 to 6 months, and 90% more than 6 months. So again, around a quarter what would be what we would call chronically homeless. But remember that those transitional homeless or less homeless less than 4 weeks, just going back to Geoff's little diagram here, they're probably somewhere along this line. So you wouldn't want to discount them, because they are likely to be the ones that become chronically homeless in the future. So the implications of these findings are that the scale of veteran homelessness is far bigger than previously estimated, and it's probably an undercount. Just to give some context, in the census, the rate of homelessness in the general population, equivalent of adults, is 1.9%. So it's 2% versus 6%. So veterans, by this estimate, are around 3 times more likely to become homeless than people in the general population. And I think that was a real shock for people to see, because often veterans are seen as actually healthier than the general population. You know, people are assessed before they go into the army for health conditions, etc. So it was quite a surprising finding, and I think we were all actually we expected a large number, but we were quite surprised at the scale of it. I don't know if Geoff was, but certainly we were, based on the previous research. And so addressing the issue requires a whole new thinking around services and policy responses. I don't think we've got time to go through the limitations, which I've already talked about. So I think I'll hand over to Fiona, who'll talk a little bit more depth about some of the issues for us.
Thanks, Ilan. Okay, so you're probably thinking, how come so many veterans are homeless? And so we were too, and what we did was look at the risk factors for homelessness using the data, the multiple data sources that we had. So we examined risk factors looking at survey data. So we did cross-sectional analysis of the surveys that was conducted from people that had men and women who had left the ADF between 2010 and 2014. So it's a large sample response group of 4,326 men and women. We also had longitudinal data that we could analyse. So there was a subsample of 2,334 men and women who had completed a survey while they were still serving in 2010, and we were able to connect to their data in 2014. So we've used that to do regression analysis looking at predicting homelessness. And we also, the veterans that were employed as part of the project, interviewed 29 other veterans, and we used those interviews to explore their pathways into homelessness. It needs to be pointed out, though, that the veterans that we interviewed were recruited by the veteran-specific support organisations. So they're veterans that are experiencing chronic homelessness. So that quarter at the end, they've been homeless for a significant period of time. A number of them were recruited from the organisation that Geoff was talking about earlier, but also in another site, not in New South Wales. Okay, so the cross-sectional analysis, just looking at the 4,326 sample, we grouped risk factors into 5 categories. Thank you. They were demographic, social and mental health factors, and those factors are shared not just by veterans but also other members in the general community. But there's 2 risk factors that are particular and mark veteran groups as different, and they are the impact of military service factors and transition factors. Okay, so the demographic, social and health factors, the people that are at risk of homelessness share a whole array of negative factors, and these are also shared by others in the general community, except with some exception about perhaps being younger. So in comparison to veterans who had not been homeless, those who reported being recently homeless were younger, were less likely to be in a relationship, they had lower levels of education, were more likely to be unemployed or underemployed, were more likely to be experiencing financial strain, more likely to report less contact with family and friends, and more likely to have lower levels of satisfaction with their partner, children, family, and were more likely to engage in risky behaviours such as speeding, gambling, and engage in criminal activity. They were more likely to report higher levels of psychological distress, PTSD, anxiety, and depression symptoms, and they were significantly more likely to report thinking about, planning, and attempting suicide. Okay, so the factors that are unique to veteran groups are the military service and transition factors. So in comparison with veterans who had not been recently homeless, those that had been homeless within 12 months were more likely to have served at a lower rank, were more likely to have served in the Army or the Navy, so not in the Air Force, and were more likely to have served for a shorter length of time. Those people are known as early service leavers, and we'll talk about them a bit more in a little while. Okay, so transition factors are there's a number of transition factors that make veterans at greater risk of homelessness. So again, in comparison to those that had not been homeless, those that had were more likely to be completely ex-serving, so had no connection to the ADF. They weren't serving still or attached through active or inactive reserves. They were more likely to have transitioned within 12 months, within the previous 12 months. And that finding is quite interesting because it's different to American research. American research has shown that there's often a long time lag between serving and homelessness. Particularly they found that in America, they found that often when they were looking at Vietnam veterans. In Australia, it looks like there might be a different period of vulnerability. So as well as perhaps being a long time lag between service and homelessness, there might be a really short period of intense vulnerability for some people. They are much more likely to have been medically discharged, so they were classified as medically unfit, and they were also less likely to have discharged at their own request, so perhaps discharged for some sort of offence. So the transition factors are important because transition is a time of intense change for these men and women. So they move from secure employment where their housing is subsidised and where all their healthcare needs are looked after, to a system where they are in the competitive labour market. They have to compete with everybody else for housing, and also it's often their first introduction to the healthcare system in Australia. Okay, so a number of those factors are unique, and then we also looked at predicting veteran homelessness using the regression analysis. So what this shows is the odds ratios, how much more likely you are to become homeless. So what it showed was that the three factors that I've identified, relationship breakdown, trouble, being in trouble with the law, and being unemployed, those factors are often in the literature as making you at greater risk of being homeless. But the odds ratios aren't often put towards this. But if you were serving in 2010 and not serving in 2015 when you were surveyed again, if you had a relationship breakdown during that period, you were 7.6 times more likely to end up to be homeless. If you were in trouble with the law, and that was only a very small sample size, but it was almost 6 times more likely to end up homeless. And being unemployed for longer than 3 months is a bit more than 3 times more likely to end up homeless. There were 2 factors that were significant risk factors that were predictive as well, and they were employment and being medically discharged. Deployment and medically discharged. The deployment results are interesting because again, it's kind of different to the American literature. So in the American literature, there's not always a clear connection between deployment and homelessness. In Australia, in this survey, it was showing that you have a 1.8 or almost 2 times greater odds of being homeless if you've been operationally deployed, but it's higher still if you've experienced deployment trauma in the Middle East. So one of the reasons why this study was commissioned as well is because there was kind of increasing concern amongst policymakers that contemporary veterans are filling the ranks of homeless veterans. It's not just of homeless people, it's not just older veterans, it's younger contemporary veterans. So being medically discharged was also a really clear risk for homelessness. So these were all really interesting to us, and so we wanted to explore them more in the qualitative data. And so what the qualitative data did was it reaffirmed the survey data, told us that homelessness is experienced by a diverse and large group of veterans. In the qualitative data, they all have different stories, but there's a number of shared features in those stories that I'll point out. They all have multiple and complex problems. There's not one single pathway into homelessness. Mental illness kind of was dominant in this group, and that was often manifest in really destructive behaviours like substance abuse and gambling. And the impact of those two risk factors, so the impact of military service and also the unsuccessful transition to civilian life marked them as a distinct homeless group. Okay, so here's just reporting some of the qualitative data. The physical health problems was really clear. It was really clear that the veterans that we interviewed had very poor health. These were the ones that had been that were sourced from veteran homelessness programs. So just a selection of the issues that they had were breast cancer, hearing impairment, limb disfigurement, reduced mobility, kidney cyst, erectile dysfunction, spinal injury, rheumatoid arthritis, osteoarthritis, open heart surgery, and one person had an ileostomy. Some of the conditions were caused by military service, as shown in the quotes below. The guy that got limb disfigurement, he was burnt badly in a training accident. So the impact of military service was really clear on their physical health, as was the impact of living without a home. So a number of the veterans that we're speaking to talked about living in a kind of constant state of anxiety, of not being able to sleep well, of not eating well, of having tremors, of just the poor condition of living in, one of them called it a state of misery. So the complex healthcare needs of this group was really clear. Their mental health problems was just so overwhelming with this group. It was really widespread. Of the 29 that we interviewed, 25 had mental health problems, talked about mental health problems. 20 of them had current and chronic mental health problems that they were receiving treatment for. These were not just chronic, they were also acute. A number of them, many of them talked about being hospitalised multiple times. Many of them talked about suicide attempts. Their mental health problems, for 3 of them in particular, predated their service. But a number of them did talk about, they talked generally well, like in good terms about their service, but they also talked about the negative impact that their service had on their mental health problems. So as this quote shows, the Army has definitely contributed to my homelessness in exposing me to what I did overseas. It did traumatically affect my mental state. And the primary reason for me being homeless is my psychological problems. My mental illness is a big one, which is why I couldn't work in the end. My PTSD is really debilitating for me. I mean, that was a 45-year-old woman. They actually generally didn't tend to say there was only one reason for me being homeless. Most of them talked about multiple reasons for being homeless, but mental health was kind of a clear pathway. There was clear substance abuse issues with this group as well. It wasn't as common as mental illness, but it was in this group. So of the 29 that we interviewed, 10 said that they had current alcohol and drug dependence problems. Some of them said that they had developed during service, and others it was after service. Others said that they used, drug and alcohol to cope with the trauma of their experiences, of their poor experiences and poor transition after service, and self-medicating. As one person said, he just, wanted to find a place to lie down and get as out of it as he could. What was clear was that the drug and alcohol problems enforced this secretive life on them. They often were too ashamed to let their family or friends know. that they were dependent on drugs and alcohol, and so they cut contact with all their family. So it did kind of make it clear that it was one of the reasons why they had such fragile family connections, or really fractured actually. And then in the 2 programs that we recruited from, or actually we interviewed a number of stakeholders, like I think it was 4 that were running programs. These programs weren't kind of single entry programs, and so what they were is like really dispersed programs where homeless veterans were given temporary accommodation. So some of it was for a medium term, but it's not long-term accommodation. But the people that were running these organisations said that it was really hard to stop the common behaviour, that they wanted to do a kind of no tolerance policy, but then one guy said, what are you going to do? You're not going to kick out everybody. So it was just a really difficult thing to control. As in the first quote, this 52-year-old man had become addicted to morphine during the service. So the morphine was primarily prescribed following an accident during service, and that was on a self-administered basis. And I gained a government authority from the ADF to obtain that. So yeah, I just used it and abused it, and then became quite addicted to it. Had to undergo multiple detoxes and whatnot to become free today. And then another man, I couldn't get over the drug addiction. It was a big factor that ended up me getting kicked out of home. And I guess that's a few years behind me now, but it's always just right there sitting on my shoulder. So these kind of destructive behaviours is really evident in their having poor family relationships. It was clear that none of the ones that we were speaking to had close family relationships. So they didn't have a family support network that they could rely on, that they could get help from. Partly it was the impact of substance abuse. It was also about their own shame about their behaviour and not wanting anybody to know how far they had fallen. And so the lack of connection was often, by them. What I found really quite interesting was that the men typically spoke about understanding their partners. So if it was an intimate relationship, their partner had clearly, held on for a long time, couldn't handle it at the end, and kicked them out. And they didn't talk about none of them said anything rude or horrible about their partner, what a bitch she is or anything like that. None of that kind of behaviour. Discussion was all very accepting, that they really understood that what they were putting their partners through was too much in the end. And it wasn't even really regret that they talked about, which I thought was quite sad. It was really acceptance was coming through. Okay, so this 46-year-old man, my parents said, look, cut your drinking, or that's it. It was over 8 years. They kept saying, stop your drinking, stop your drinking. It got to the point where my family sort of drew a line in the sand about my drinking, and I didn't listen. A number of them said similar things. I won't read any of these quotes, but unemployment was another pathway into veteran homelessness that I think was really sad, because what was really clear was that they all had a really strong desire to work. It was while lots of them joined the ADF in the first place, a number of them were from kind of regional areas or, far out suburban areas where they didn't think that they could get a good job, and they really saw the ADF as a pathway into gaining qualifications. They were so disappointed about the fact, a number of them were so disappointed about the fact that they didn't get anything in the ADF. So they ended up, the ones that we interviewed, so this sample with, typically with no qualifications. So what they ended up with was really insecure short-term work, which meant that they had transient lifestyles. They were, moving all the time from some crap job to another crap job. Manual labour was what they typically did. But when you would ask them about when the veterans asked them about their future goals, it was about getting a good job. So employment was really important to these people. So one of them was sad. I thought it was going to be fantastic. I saw opportunities there. I thought maybe I could get a career, but then I think probably I chose the wrong call. They often blame themselves for that, because I didn't end up with any sorts of skills. I had to start at the bottom, just doing anything I could, and I actually ended up getting a job after about a year at a chicken processing plant. I mean, it was those types of stories that were sad to read. The transition is another risk factor. What was really clear overwhelmingly was that the majority of the men and women weren't prepared in the transition phase for life as a civilian. So almost all of them said that they were unprepared and unsupported. And remember, a number of them were transitioned out with medical issues. So they are medically classified as unfit for service, and then they, I know we're only seeing the worst of them, but this group a number of them have been medically discharged, they're unfit, they're unsupported, and they don't get any kind of training about how to cope with this as well. A number of them are also really unwell. They didn't kind of actually know that they already had a serious mental health problem until they reached a crisis point and, were hospitalised. It was a culture shock that a number of them talked about. They had lost their identity. They're at the bottom of the labour market. They don't have the community of Defence Force personnel around them anymore. Also, a number of them say that the transition process has really changed now. It's so much better. Those quotes are exactly the same. They got nothing. One of them's 47, one of them's 28. So even now, they're still getting the same type of response. Okay, so the implications for the risk factors are that we should be using these risk factors to inform development of better policies. I'm not going to go through all of it. It's far too much, but we know who's at risk of homelessness and we should be doing something about it. We can use this kind of information to better target people who are at risk of homelessness. And so what I would kind of think about too is that rather targeting them at this point, so when somebody's already been, arrested or charged with a crime or, seeking, unemployment benefits, I think they should be targeted at the transition phase. So early service leavers with no qualifications and low unemployment leaving the ADF are at really big risk of homelessness, and there is no retraining and kind of re-education program, but it's kind of clear here that sort of support is required. Okay, so the broader conclusions for our project are interesting in that it's the best estimate of veteran homelessness done to date. What we also showed is that more data sets are needed, because even though we found out so much that wasn't available before, so much still needs to be known. So what we don't know is the geography of veteran homelessness. So where are all these homeless veterans? And we don't know the effectiveness of any services. There has been no evaluations done of these programs, and we don't know trends over time. So is it increasing? So we couldn't actually say what's happening with contemporary vets. So are younger veterans becoming homeless at a higher rate? We don't know anything about older vets as well. They're like a kind of absent group. I just wanted to quickly, tell you about the postscript to the study, what has happened to it. So yay, isn't this fantastic? We finished it, and then the DVA is going to release it to so much fanfare. Well, that didn't happen. And so what did happen was the release of our study was released by the minister, and it was framed as one of two important pieces of work. The other piece of work was done by the Australian Institute of Health and Welfare. It does a kind of rosier picture of veteran homelessness because it's talking about them all receiving services. Isn't that great? And that was the study that was given dominance. No, there was no mention in the press release about our estimate. About 5,800 men and women are homeless every year in Australia. After it, the DVA said that they were going to have 2 workshops with veterans and industry representatives to talk about policy solutions. What can we do to address this? But then no one on the study team, none of the researchers were invited to those workshops. So we're not really sure what happened there. The DVA confirmed after the study that they weren't going to fund the transition and wellbeing research program anymore. That had been rolled out as, the most the best study in Australia on veterans' mental health and wellbeing, which will just be a cross-sectional data set now. You won't get any longitudinal data, no follow-up on the mental health of this group. Where they are funding is the Veterans Health Unit in the Australian Institute of Health and Welfare, which means that it's another government agency that is getting money. That's concerning to me because it's we found it almost impossible to get ethics approval for this study. It's why it's lasted 3 years. And I think it would deter independent researchers, particularly, if most of the money is going to another government agency and staying there. Finally, 2 of the veteran researchers that we worked with that were in frontline support roles during the project are no longer in those frontline support roles. So it was that role took such a huge toll on them, and they succumbed to professional burnout and stress. So the report also talks about the huge workforce challenges in this issue. Okay, so I'm sorry that we're ending a little bit late. Hopefully there's time for questions now to Geoff, myself, or Ilan. Thank you.